and welcome to the Caelum Wellness Retreat. My name is Calliope, and I'm going to be taking care of you today. How are you doing today? Okay, I see. I hope by the time you leave this treatment, you feel even just the littlest bit better. So let me see what we have for you today. Interesting. So you chose one of the newest additions to the Caelum Wellness Retreat. You had booked a core therapy treatment. Core spelled with a K at the beginning. Is that correct? Interesting. So any particular reason why you were drawn to that treatment? Yes, it's not very common here in the US. I've seen that primarily it seems to be pretty popular over in the United Kingdom, actually. So this is something we recently heard about and we're quite intrigued by, so we added it to our list of possible services. So, did you happen to read up about it at all when you saw it? No. Okay. So, with core therapy, it is almost like a combination of many different modalities. So, we found it pretty easy to work it into our list of offerings because it combines Eastern and Western medicine or modalities. So, for example, when we start with a core therapy treatment, we test your muscles. This is also known as kinesiology. And when we have identified what areas are a little weaker, what areas we need to address, then based on your symptoms, based on your weakness, we choose an appropriate modality to address your concerns. For example, we might go in with some deep tissue massage or myofascial release. Maybe we'll look at Tui Na or Qigong. Different types of modalities that one may find either as a specialty or as a broad offering, like in a massage therapy office. So we really have quite a lot of different options, different routes we can take when we're working with treating your body. So it really feels like a bespoke treatment. It really feels like it's being tailored to you. You're not getting one modality for the entire duration. You're getting a combination of them to specifically address what it is that your body needs. Okay? I know that's a lot of information, and we can break it down bit by bit as we go along in the treatment. Okay? All right, there's no need to memorize any of this. So I want to first ask if you have any particular concerns, whether it is physical concerns or perhaps you are having a lot of emotional stress, situational stress in your life. Is there anything that you wish to be looked at and addressed today? Okay, absolutely. I can definitely take a look at that. So I am going to real quick just sanitize my hands, and then we're going to do a little bit of rearranging, and then we will start the therapy, okay? So for our treatment today, I am going to need to be touching you. Is that okay with you? Do I have your permission to do that? Wonderful. Thank you. Get our hands sanitized. And then we will start the treatment. Very good. Now what I'm going to have you do is I will have you lay down on our massage table here. We'll start with you facing up, okay? At some point we may need you to flip over, but we'll start with you facing up, and I will be walking around you. I may be sitting down at parts. It's going to be a lot of movement, okay? But I'm going to tell you what I'm doing the whole time so you're not lost. If you feel any pain or discomfort, please let me know, all right? This should be essentially a painless process, okay? All right, so let's go ahead and get you all situated. Hey, how you doing? Okay, are you comfortable? All right, and how's the temperature of the room? Does it need to be any cooler, any warmer? I like to keep it a little toasty, but I know some people don't. Okay? You just let me know if we need to change that at any point. So we are going to start with the kinesiology testing. And as I mentioned before, that is where we test your muscles and ascertain if there is any particular weakness in a muscle. So first, I am going to raise one of your legs, have you raise it, and I'm going to try to push down on it. I want you to resist me. I want you to try to hold your leg in place against me pushing it down, okay? All right, so if you could raise, let's do this leg right here. So this would be your left leg, okay? Can you raise your left leg for me? Good, and I'm going to try to push it down, okay? I want you to hold it in place and don't let me do that, okay? All right, good. Go ahead and put that down. And if you could raise your other leg for me. Okay, just raise it up. There you go. And I'm going to try to push down. I want you to resist me. Okay, good. So we have a good amount of strength, firstly. And this time I'm going to hold your leg and your arm up, and I'm going to try to push them both down, okay? So let's start with this leg closest to me. If you could raise this leg and also your arm here at the same time, all right? Okay, and I'll just be holding each of these. I want you to hold them in place, and then I'm going to press down, okay? And down. Okay, and go ahead and let them go. Them go ahead and relax. And then I'm going to move to the other side. And let's have you raise this leg and this arm up. Okay? Go ahead and raise them up, and I'll support you a little bit here. Okay, and then we are going to press them down. I want you to hold against me, resist me pressing down, okay? All right, and go ahead and relax. So I am going to check your sacroiliac here. So I'm just going to firstly come under you, right at your lower back, the small of your back, okay? We have the sacroiliac joint right in there, just a little bit lower. So we are going to be testing this area. Okay, and then this time I'm going to go across here. So this side away from me, you're going to raise your leg, raise your arm at the same time. Let's go ahead and raise those. Good, and I want you to hold for me, and I am going to be pressing them down, all right? So go ahead and hold, 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 that go. All right, so that looks good. Just give me a second. My hair is always in the way. Now, this time we're going to do opposites. So, for example, if we raise this leg closest to me, we're going to do the opposite arm over here, okay? I know, don't worry, I'll guide you through. So, this leg right here that I have closest to me, let's go ahead and raise this up, and we'll raise the other arm, all right? So this is going to be your right leg. We'll do the left arm. You could just raise that up for me. Right leg, left arm, okay? And hold these in place while I push down, okay? Go ahead and hold in place. Hold, hold, hold. And okay, go ahead and relax. This time, we're going to do the other side. We'll have you lift the left leg up and lift the right arm up. So if you could just lift that leg up for me and the arm, okay? And then I'm going to press down. I want you to resist against me, okay? Go ahead and hold. I'm going to press, 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 press. And you can relax. Go ahead and let these relax. Now I'm going to be moving your arm a little bit, okay? So firstly, I am going to just come around to the other side. And I am going to take your 2 fingers here, 2 fingers, and we're going to put this on the hinge of your jaw right here. So we have your fingers, just give me 2 fingers here, and put these right here, right along your jaw, okay? And I want you to just hold them just like this, okay? And we're going to do some testing with that. So I'm going to have you lift your left leg here, and we're going to have you lift your right arm, okay? So keep holding on your jaw here, and we're going to lift up this leg, lift up this arm. Lift, good, and go ahead and hold for me, okay? And I'm going to try to push down. So let's go ahead and push. Hold against me. Okay, and let's relax. All right, just let that relax. So this time, let's go ahead and take your hand off of your jaw, and we're going to have your opposite hand come up and hold that spot on your jaw. Okay, so this arm right here, I'm going to have you take this and put your fingers, 2 fingers, right here on the hinge of the jaw. Right here, okay? All right, so you go ahead and hold there, and I'm going to have you lift this arm, the one that's not holding onto your jaw, and the opposite leg, okay? So let's go ahead and raise this arm and the opposite leg here. Okay, raise it up. And I want you to hold against me. I'm going to try to push down. I want you to resist me. Press, press, press. Pressing down. Okay, and go ahead and just relax here. Now we're going to switch. So now you're going to put that hand that's right here, switch it to the other side, okay? So take this hand and put it right here, right along the hinge of the jaw, right there. Good, and hold that. And we'll lift this arm and this leg, okay? So the arm you're not using, the opposite leg. We're going to lift these two up. Good. And I want you to hold, and I'm going to try to press down, and you just resist me. Okay? Press, press. Good. And go ahead and relax. And this time I want you to switch hands. So you're going to cross your arm over your body, this arm right here. Cross your arm and put your fingers right here, right on the hinge of the jaw. Okay? Good. So then we're going to test this opposite arm here and the leg closest to me. So let's lift this leg, the opposite arm, lift up. Good. And then I am going to press down. I want you to hold against me. Okay? All right, you ready? Good. Let's go ahead and press, 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 press. Good. Okay, and relax. You can take your hand off of your jaw here. Okay, just relax for me. Good. So what I was testing there is I was testing the TMJ joint, right? So I am not going to be telling you what I will be testing. I'll probably tell you afterwards. The reason that I do that is because some people want to help out a little subconsciously, or they react subconsciously, so that influences the test. So if I were to tell you I'm going to test your jaw, you might react differently than if I didn't tell you at all. So your TMJ joint here, we did have some issues there, and most people do. But the TMJ joint, when we do have issues with this joint, it affects a lot more than we think it does. Now, I want to tell you a little anecdote about that in particular. So, I suffered with debilitating tension headaches for about a year. And in addition to that, I had some extreme balance issues where when I would walk, it felt like I was walking on a waterbed, and my body was constantly tipping to one side or the other. Now, most headaches arise from muscle tension. So I went to physical therapy, and I had all sorts of exercises that helped to unlock this joint right here and help to address the muscle tension that in part was contributing to my balance and headache issues. Now, we don't think of our TMJ joint affecting our balance in the way we walk, but in fact it does. And when we do have a lot of tension in here, it is possible for us to have issues with walking. Now, after a lot of physical therapy and a lot of continued work on this TMJ joint, for the most part, I've regained most of my balance, and it's a very rare occurrence that I do have tension headaches. So that's a little bit of how that particular area can affect your body. So what I'm going to do, for you, I'm going to do a little bit of a TMJ release, okay? I'm going to go behind you, and I'm just going to hold this area. And I'm going to be using very small movements. And we're going to open this area up, give it a little bit of a stretch. And that way, we can help address this issue, okay? So I'm going to come around you. And I am just going to place my hands on either side of your jaw, and I'm mostly holding you with the muscles at the base of my thumb here, okay? So this is a bit of a strange hold, but I'm just going to hold this here, and you will feel very minute movements in this. We're just going to wait for your jaw to release a little bit, okay? Now we also can continue to address this. We might do some stretching and we will address what is making your jaw so tight. For many people, it happens to be stress. Sometimes we grind our teeth at night. Sometimes we unconsciously clench our teeth. So when we address this, we can address some of that pain and weakness. I'm feeling this open up just a little bit. Takes a little bit of time, and we don't want to force it at all. I can definitely see that perhaps in your future, we could do something like a myofascial release on the inside of your mouth. That'll be a little bit of fine-tune work. We'll start with addressing this right now. Are you feeling the muscles relax a little bit? I'm definitely feeling them start to loosen up. Just wanted to see if you are also getting the same sensation. We'll just live in here for just a few more moments. And then we will continue with the testing. Okay. All right. And I'm going to release you there. And I'm going to come back around. How's the jaw feeling? You can go ahead and open it up, move it from side to side, see how that feels. It's a bit of a strange feeling having your jaw suddenly open up when it's been so rigid for a while, especially having your mouth have a greater range of movement. It's quite an odd feeling, definitely. So now we're going to go ahead and do the opposite arm and leg, okay, like we have been doing. I'm going to have you raise this arm closest to me, your left arm, and we'll have you do your right leg over here. Okay, so lift the arm and the leg. Lift, lift, lift. Good. And then I am going to press down, and I want you to resist me. Okay. Good, and let those relax. And now we're going to do your right arm and your left leg. I want you to lift them up, okay? And I am going to press down. You know the song and dance by now, huh? Yep. So lift them up, and I am going to press down, okay? Press, press, press. Good, and relax. So I'm going to be feeling around your joints. I'm going to start with your hips, your knees, your ankles, and we'll take a look at your feet as well. So just know that I'm going to be feeling around the hips firstly, okay? do let me know if there's any pain or discomfort here. Okay, and let's come down to the knees. Okay, and the ankles. Right, and let me take a look at your feet here. So don't move your feet, just let me see how they were. You can tell a lot about a person by the way they orient their feet, whether they go one way, the other, the whole leg is turned one way or the other. Just taking a look at that. Okay, and I'm just gonna grab on your feet and look. Okay, interesting. All right, I'm gonna come back over here and just going to work in the hip here. Good. And then we're going to just raise your leg. Okay, so let's raise your left leg here. Raise up the leg. And I'm just going to be pressing down. I want you to resist me. Good, and relax. Let's work right here. Okay. Good. And raise up the leg, left leg here. Raise up. And I'm going to press down. I want you to resist me. Good. Go ahead and relax. Okay, right here. Okay, let's raise up this leg and raise up the left leg. And I'm going to be pressing down. I want you to resist me. Good. Let's let that relax. Okay, what about here? Right? So raise the left leg. Yep. Left leg, and I want you to resist me as I push down. Good, and relax. And last one. Let's do right about here, I think. Good. You've been a wonderful client to work with so far. Just wanted you to know that. I really appreciate your cooperation. And we're going to lift up this leg. Good. And I want you to resist me as I push down. Good. And relax. Okay. So that was your hips. Probably tell by the way that I was feeling around different areas of the hip. We were testing the hip, the muscles around there, the structures. So now I'm going to go ahead and work with your arms. So I am going to twist your arm so that it is facing out, so your palm's facing out. Okay, twist it inwards. And I'm going to press this up against you so that it is glued to your side, essentially. Okay? And I am going to have you resist me pulling it outwards, okay? So I'm going to try to pull your arm outwards, and I want you to resist me. So I'm going to get my hands in here, and I want you to just hold as I try to pull Good. Okay. Go ahead and relax that arm. Let me just do that on the other side. So we're going to twist this arm in so that the palm is facing out. And I'm going to press your arm into your side. And same deal, I want you to resist me. I'm going to try to pull towards me. And I want you to hold against me. Okay, so I'm just going to pull, pull, pull. And very good, very good. All right, so let's take a little look at your ICV. And this is your ileocecal valve. So I am going to press on your stomach. And I want you to let me know if there's any pain or tenderness where I press. Okay? Okay, right about here. I am going to press into this right here. And I'm going to take your hand and we're going to put 2 fingers right in this area. And we want to do the same pressure that I'm doing right now. Okay? So let me take your hand and press right here. Good. And I want you to keep pressing there. And I am going to raise your leg and I'm going to try to push down. Okay, I want you to resist me. Okay, so raise up the leg. Good, and hold against me. Okay, good, and relax. This time I'm going to place your hand, we're going to do the whole hand here, like you're cupping. Okay, whole hand is going to go right here. Yep, just a little bit above that area. More towards your rib cage. Good. Okay, and we're going to lift up your leg and do the muscle test. Lift up your leg for me. Okay, and I'm going to press down, hold against me. Press. Okay, very good. Relax your leg down. Now I am going to have you press your fingers in right here. It's in the general vicinity of below the sternum, kind of in that middle area. So right here. Press down right here. Okay, and I'm going to have you raise your leg for me. Good, and I'm going to press down. I want you to hold against me. Okay. Okay, very good. You can go ahead and relax your arm. Put it back here. Now let me just work right around here. Give me just a moment. Okay, so now I am going to have you raise this right leg for me. Raise it up and hold against me. I press down. Okay, good, and relax the leg. You can lower it down. So now we're going to do a little bit more rearranging. This time I'm going to have you flip on your back, okay? Go ahead and flip on your back and we will continue. Okay, are you comfortable? Yeah? All right, so I am going to have you put your pinky finger and your thumb together as tight as you can, okay? Yep, these 2 fingers right here. This would be on your left hand, right here. Good, and I'm going to try to pull them apart. I want you to resist me. So let me try to pull these apart. Good. And just going to work around the sacral area here. Okay. Put your pinky finger and thumb together again, and I'm going to try to pull them apart. Okay. Pull, pull. Okay, and relax. And we'll work a little more here. Okay, and then go ahead and put the pinky and thumb together. I will try to pull them apart. Good. Just feeling around, feeling where I want to test. Okay, and I'm going to try to pull your fingers apart again. Want you to hold them against me. Good. And last time, just feel my fingers, the base of your spine here. Okay. And I'm going to try to pull your pinky and thumb away from each other. Pull, pull, pull. Good. Okay, that looks good. So that's going to be the last of the muscle testing that we're going to do today. All right. So while you are on your stomach, I am going to work with some Tui Na on your back. Tui Na is a type of massage that comes from traditional Chinese medicine, and it features a lot of rocking motions. It's not going to be like a typical Swedish massage, but we're going to work with your body and we're going to rock it, okay? It sounds a little strange, but you'll see what I mean. So we're gonna start right on this side. I think this is the side where we need to do the most work. So I am just going to be rocking the body back and forth. So you'll feel my fingers and my hands go up the back and rock the body back and forth and go down. And I'm staying on one side of the spine. I'll work one side at a time. Rocking back and forth. How does this feel for you? Okay. So you're a little rigid. We want to see your body move in waves. If you've ever played with one of those little wooden snake toys that moves back and forth, it's made of those little discs. We want your body to move in a way like that. But we'll work with you. We'll work with your body. This is just the beginning. Okay, we'll even get along the hips here. Might hear the table creak a little bit since we're getting a lot of movement. Good. Okay. We're going to do a little soft tissue release, I think. So I'm going to press down right here into your hip, And I want you to raise your knee for me. Okay, right, just like that. Raise up your knee. And I am going to have you slowly lower your leg down, right? So I'm pressing in to the hip here, and I'm going to have you slowly lower your knee. There you go. There you go. Good. Okay, go ahead and raise that up again. Okay, and slowly lower as I'm pressing into your hip. Good. Okay, one last time, raise your knee. Then I want you to slowly lower it back to the table. Good. Okay. So let me come to the other side here. And we're going to work on the other hip. So just like before, I'm going to press down here. I want you to raise your knee up. This would be your right knee. Raise that up while I'm pressing down. And then I want you to slowly lower your leg back down. Good, nice and easy. Okay, and bring your knee back up while I'm pressing into the hip. Good, and slowly lower it back down. Raise it up one more time. Okay, as I press in, you're going to slowly lower that back down. Excellent. Now, while I'm on this side, we're going to do our rocking on this side of the body. We're going to use the spine as the boundary and only stay on one side. And my hands are going to be working up and down the back. We're going to keep rocking the body. This helps loosen it up, gives it a little bit of stretch. The body really enjoys to be rocked. It's not something we get in our day-to-day life. But it's something that many people quite enjoy, and it satisfies a deep craving in our bodies. So now we're going to do a little bit of work with the shoulder area. And I am going to have one hand that is pushing forward and one hand that's pulling back. So we're going to get these two opposing forces go back and forth along the upper back and the shoulder area. So one hand goes forward, one hand pulls back. Back and forth. We'll work with this a little bit on both sides. Good. Okay, and the other side. I outside hand pulls up while the one closest to the spine goes down. Back and forth. Great. How does this feel? Yeah, this really helps to loosen up the upper back and the shoulder a lot. We're also going to stretch out and rotate your shoulder around. We're going to do what's known as a wing stretch. Okay? So I am going to grab your arm here, and I want you to let me take the weight of it. We want this arm to be real relaxed. I'm going to pull it off the table, and I'm going to hold on to your upper arm. So just let your lower arm dangle. Okay? We'll do a little rotation. We'll shake it out a little bit, rocking it to and fro, making sure that it is as loose as we can get it. And then I am going to have one hand that's under like this, and your arm is going to bend at the elbow, and I'm going to thread my arm through. It's a bit of a complicated motion here. I'm going to thread my arm through here. So our arms are kind of interlocked in this little complicated movement. But this way I can get a really good rotation on the shoulder. And I'm moving this in a real big circle here. Just taking that shoulder, giving it a good rotation, good stretch. Just like that. I'm going to take your arm and we're going to shake it out a little, rock it back and forth. Okay, and I'm going to put your arm back. Good. I'm going to press your shoulder down. We're going to weigh this down, press it back into place. It's not hitched up. Press it down, and then we're going to move to the other side. Okay, so let me take your arm, and I'm going to hold your upper arm. Let your lower arm relax, go floppy. We're going to shake out the tension a little bit, get it as relaxed as we can. Good. Okay, and we're going to bend your elbow, put your hand on your back while I am under your shoulder here, and then my other arm threads through. And then we're going to rotate your shoulder. Big circles. Big circles. Excellent. Good. Just with the big. Good. And then we are going to hold your arm and shake it out a little. Rock it back and forth. Let the tension go. Good. And I'm going to put your arm back and then we're going to press down on the shoulder. Press on the shoulder. There we go. Just like that. Press down. Okay. All right, so that's going to finish the Tui Na portion, and that's going to finish our core therapy treatment for today. So I'm going to give you a moment. You can come back to sitting, right? We'll chat for a minute. And there we go. How was your first core therapy treatment? It's pretty involved, wasn't it? It's a lot of moving pieces, yes. But it kind of feels nice to get your body engaged, right? I imagine you'll leave here feeling pretty loose and relaxed, but energized at the same time. Invigorated, maybe would be a better word. Yeah? So this is the start of core therapy. And this is a treatment that ideally you would keep going for, especially because it will change every single time to suit your needs. So we adjust a lot with the hips and your back. We also address the jaw. So those were our main complaints today. Those are things that we can keep up on, and we can also investigate along the rest of the body and see what else is going on. Okay? Right? So you just give us a call, let the receptionist know if you'd like to come back to the Caelum Wellness Retreat for another core therapy session. We'd absolutely adore having you here. Okay, you were a model patient. I really appreciate it. Do you have any questions for me before we go? Okay, very good. So I recommend that you take it easy for at least the next 24 hours. Drink lots of water. That'll be great for your body, and especially with all the stretching and moving around we did, that'll really help rehydrate the body. So that'll be about it. I really hope that you enjoyed this treatment. I enjoyed having you here. I hope you have a whale of a day and a good rest of your night. Thank you. Goodbye now. Thank you so much for watching this video. I really appreciate it. I create primarily medical, alternative medicine / pseudoscience and personal attention ASMR roleplays. If you want to check out a specific category of my videos, my channel playlists have everything from sci-fi to historical to even fantasy videos. If you want to support my work, consider checking out my Patreon profile in the description box, where I offer early access to